Bismillahirrahmanirrahim. Assalamu alaikum everybody. It is me Dr. Sabahat. Today we would discuss the anatomy of urinary bladder. Urinary bladder. An empty bladder in adult is entirely a pelvic organ. It expands superiorly into the abdominal cavity, hypogastric region when full. Normally in young children, the empty urinary bladder projects above the pelvic inlet in the abdomen. In the diagram, we can see different regions in the abdomen and pelvis. The regions given are epigastric region in the middle, the right hypochondrium region, the left hypochondriac region, umbilical region below the epigastric region, the right lumbar region, the left lumbar region, hypogastric region or the pubic region below the umbilical region, the right iliac or inguinal region, and the left iliac or inguinal region. Urinary bladder is located immediately behind the pubic symphysis. An empty bladder is pyramidal in shape. It has an apex, a base, which is called posterior surface, a superior surface, two inferior lateral surfaces, and a neck. In females, on the posterior surface of the bladder lies the vagina, a remnant of the embryological urachus that contributes to the formation of the bladder. Apex of the bladder. Apex of the bladder is directed forward and lies behind the upper margin of symphysis pubis. Apex of the bladder is connected to umbilicus by median umbilical ligament. Superior surface. Superior surface of the bladder is covered by peritoneum. In males, it is covered completely, while in females, it is covered incompletely because of uterus. Boundaries. The boundaries of the superior surface of the bladder in males are related to colic of the ileum and sigmoid colon, while in females, it is related to uterus. Inferior lateral surfaces. Inferior lateral surfaces are related to retropubic fat separating them from the pubic bones anteriorly, while posteriorly lie in contact with obturator internus muscle above and levator ani muscles below. Retropubic fat. Retropubic fat accommodates distension of bladder. It is continuous with anterior abdominal wall. Rupture of bladder results in escape of urine to anterior abdominal wall. Neck. Neck of the bladder is the inferior and most fixed part of urinary bladder. It is related to lower border of symphysis pubis. In males, it is related to upper surface of prostate gland. The smooth muscle fibers of the bladder are continuous with those of the prostate. The circular muscle fibers are thickened to form the sphincter vesicae. Interior of the urinary bladder. Mucous membrane in the interior of the urinary bladder is folded except in the trigone. Now what is a trigone? Trigone is a triangular area in base, which is the posterior surface of the bladder, bounded by the two ureteric orifices and internal urethral orifice. Uvula vesicae. Uvula vesicae is an elevation behind the urethral orifice. It is produced by the median lobe of prostate. The normal capacity of bladder is about 300 to 500 ml. As bladder fills, the superior surface bulges upward into the abdominal cavity. The peritoneal lining is peeled off the lower part of anterior abdominal wall and the bladder comes into direct contact with the anterior abdominal wall. Blood and nerve supply of the urinary bladder. Arterial supply. Arterial supply of the urinary bladder comes from the internal iliac artery. Venous drainage. The venous drainage from the urinary bladder drains into internal iliac vein, while lymphatics drains into internal iliac lymph nodes. Sympathetic nerve supply of the urinary bladder comes from the L1 and L2 spinal cord segments. Parasympathetic supply comes from the pelvic splanchnic nerves from S2, S3, S4. Sensory nerve supply transmit pain due to over-distension of bladder. Urethra. The urethra conveys urine from the urinary bladder to the outside of the body. In females, it is 3 to 4 cm, while in males, it is at 18 cm. Due to shorter urethra in females, females have a greater risk of urinary tract infections. The male urethra has three regions: prostatic urethra, membranous urethra, and penile urethra. They all can be seen in the labeled diagram. While the female urethra opens anterior to the vaginal opening. The male urethra has a membranous part which is 1 cm in length, surrounded by external urethral sphincter. The penile or spongy urethra, which is 16 cm in length. It is the narrowest part of whole urethra, extends inside penis, and opens externally through external urethral orifice. The male urethra has both urinary and reproductive functions, while the female urethra has only urinary function. This was all about urinary bladder. Thank you very much for listening.